Hi, I'm Dr. Langley, and I am your friendly neighborhood Department of Transportation medical examiners. Uh, I live here in Colorado Springs, and in my practice as a family physician, I offer to those who are a member of my practice to do their DOT exams for them, whether it's on an annual, biannual, every other year kind of basis. So I wanted to go over with you YouTube community of what those exams are like, whether you're someone who's going into this kind of exam for the first time or you've done this before. Maybe this will give you some clarification on what we're going to be checking for and why we check it and why it's important for you to be honest with us. So I took a test for the FMCSA, the Federal Motor Carrier Safety Administration, part of the Department of Transportation. And if you want to find out even more information, their website has all sorts of nice information on it. I'll post it right there. But if you just want to jot down the website as well, it's nationalregistry.fmcsa.dot.gov. And they have a resource center there that actually has a copy of the medical exams that are the medical papers that are the exact ones that you'll get from your employer to take with you to your exam or that your doctor will provide for you. I provide them because it's got my information pre-filled out, which is kind of convenient. The most important thing that you're going to be filling out before the appointment or just in the waiting room, depending on how your doctor's office works, is the history. So that's when you get to go into what medical issues you've had in the past, what medications you currently take or take just sometimes, but on a regular basis still. And that's important to make sure that we get all the details on you. I mean, a lot of this exam is based on our trust in you as to whether you are providing the accurate information. If we get the feeling that you're not being honest with us, I mean, this is a matter of life or death on the roads. Driving a semi, driving other commercial vehicles is a very trusted position in our society. There's a lot of risk of having people that are not in great health driving. If they're able to fall asleep at the wheel because of a condition that we could have prevented, that is a tragedy. So that's what we consider our jobs are as medical examiners, is we're trying to keep the roads safe for our own community, for our own families. So we're going to take this pretty seriously, that we really want you to be forthcoming with us with what you're taking, with why you take it, with how often you take it, and whether you've ever had any problems with it in the past, whether it makes you feel sleepy, whether you have to take it all the time. And the more honest you are with us, the more we'll have faith that you are being honest with us, and the better we can communicate about keeping you safe on the road, because obviously your life is at hand as well with these large vehicles moving quickly. There's a lot of damage that can happen to you as well as the community if we don't do our jobs. So going through your history and medications, you can see that on the forms. And then the actual physical consists of an eye test, checking not only for distance vision, whether you have glasses or contacts, whether you have vision in both your eyes, whether you can see the colors that you need to, especially for stoplights, basic stuff like that. We're also going to look at your urine. There's certain signs of diseases that we can look for in your urine to make sure that your kidneys are functioning well, that you don't have signs of diabetes, things like that. We'll also be checking your hearing, a pretty basic test, but just to make sure that you're going to hear what you need to on the road, as well as your blood pressure. The lifestyle of being a commercial driver does put you at risk for having heart disease, high blood pressure, high cholesterol. It's hard to take care of yourself, to get the exercise that you need, to eat the proper foods that you need as a commercial driver. So we want to make sure that we're doing everything that we can to keep your heart healthy, to prevent you from having strokes. And part of that is making sure that your blood pressure is in a healthy range. So that's definitely less than 140/90. Most people prefer less than 130/80. And we have very strict guidelines as to how long we can approve you for as a commercial driver, depending on what your blood pressure readings are. That's a lot of out of our hands. There's no interpretation in that. If your blood pressure is high, we can't do much about that. We can't give you the full 2-year certification that we'd like to. So that's what you can expect, is urine sample, hearing test, vision test, basic vitals, blood pressure, that sort of thing. We'll also do a once over of your body, a little basic physical, listen to your heart and lungs, look into your throat, see if there's signs of your tonsils being pretty big, which might be an indication of obstructive sleep apnea, and that would make you very sleepy during the day and very much a danger to yourself and to others if you're going to possibly be falling asleep at the wheel. No one wants that. So getting you checked out for sleep apnea might be a requirement before we can approve you. I'm also looking for specific diseases that can cause problems with driving. We already talked about high blood pressure. Also, diabetes is a big one, in part because if you're on insulin or many other diabetes medications, it can drop your blood sugar too low, and that will make you not be able to function, not be able to think clearly, and that's obviously a big problem if you're driving. Also, a history of fainting, also called syncope, is something I'm going to want to hear about specifically. History of seizures, obvious why seizures and fainting are a bad idea while you're driving. A history of stroke or heart attack is helpful for letting me know what you're at risk for to keep you in good health. It's hard work being a driver, and it's not a healthy lifestyle generally. So anything that I can do, again, to help make you more healthy is going to be in my best interest, in your best interest, and everyone's. And also any history of a psychiatric diagnosis is good for me to know about. Not that I think that just because you have some anxiety or have some depression, you're going to be a bad driver, but so that we can talk about it and be open about how well treated are you doing, what are you doing to take care of that, are there other ideas that I have that might help you get your symptoms under better control so that your life can be a better life as well. So I hope that this can calm your nerves a little bit if you're getting ready for that DOT exam. It's not just about trying to find things that disqualify you. It really is honestly about trying to keep you safe as well as the community safe. And if you're interested in watching more videos about what I have to say about medical things, go ahead and click on that one. That one might be helpful. And then be sure to subscribe to us right there so that you can find out when we put out new videos. Thanks for watching.